First of all, let me invite Mihály Kökény, that was just speaking now. He's now a lecturer at the University of Debrecen, but hold important position in Hungary as a Minister of Health, and also one of the co-authors of the book on by FEPS on the European Health Union. Thanks for being with us. Another former Minister of Health from the Czech Republic, Svatopluk Nemeček, please join us. After your time at the ministry, now you are much closer to Poland as well, because you are president of the board of the municipal hospital here in Bohumin, which is not that far away. And then I'm very happy to have here with us also Nicholas Moravec. Please join us in the panel. Nicholas, and I'll actually start with you, Nicholas, telling also to the public why we strongly wanted you here, because you are one of the citizens that took part in the European Commission exercise on the future of the European Union, the conference on the future of the EU, in which several citizens have been randomly selected to participate in panels to check, okay, what do citizens want from Europe? You took part particularly in some working groups dealing with health, and you are also responsible, together with the other citizens, of this long report with many recommendations. And we have discovered that the citizens of Europe are a little bit more progressive than their governments. So we really would like to hear from you what was this process a little bit, and what are the recommendations on health that came up in this discussion.
I will be speaking in Czech. Takže ještě jednou já vás všechny zdravím. Ano, ten proces probíhal, řekněme, ze začátku to vypadalo velmi jednoduše, kde se vlastně vybralo 200 náhodných občanů z celé Evropské unie, kteří jeli na zasedání do Štrasburku, kde jednali. Já jsem pracoval v panelu zdraví. Nás se potom vybralo 20 ambasadorů, kteří potom každý měsíc lítali na plenární zasedání a diskutovali ve Štrasburku s dalšími politiky a experty. A náš panel přednesl několik doporučení, já tady řeknu asi ty nejzajímavější. Jako jeden, co by jsem tady rád řekl, tak se týká zubařů. Protože si myslím, že zubaři netrápí jenom Českou republiku, ale je to problém v celoevropské unie. My jsme prosadili, že by měla být stomatologická péče dostupná všem od 15 do 20 let a mělo by se do ní masivně investovat, protože nemělo by to tak být, že prostě si někdo nemůže toho zubaře dovolit z toho důvodu, že nemá peníze. Další důvod je ten, že když hledá zubaře, tak ho nenajde, protože ten zubař prostě není. A takhle by to být nemělo, jo? Zuby jsou něco, co prostě potřebujete k životu, třetí zuby vám prostě nenarostou. Tak to je. Potom jsme mluvili o tom, covid nám ukázal to, jak by to fungovat nemělo. Mluvili jsme o tom, že by Evropská unie v rámci nějaký další pandemie měla mít větší pravomoce, protože dám tady příklad, třeba ve Francii, když jste se očkovali, tak vám certifikát začal fungovat 7 dní potom, co jste si píchli tu vakcínu, a v České republice to bylo 14 dní, přitom se jednalo o stejnou nemoc. A my jako občani jsme se na tomhle shodli, že přece takhle by to fungovat nemělo a Evropská unie by v tomhletom ohledu měla mít větší pravomoce, když by měla přijít nějaká případná další pandemie. Dále jsme probírali zdravé potraviny. Měl by se víc zkoumat dopad antibiotik na zvířata a co by potom na člověka. Tohle je taky velmi horké téma, protože kolikrát vy si řeknete, že vám ta potravina chutná, ale ani nevíte, jestli vám ta potravina opravdu chutná, nebo je to díky nějakým přidaným látkám v té potravině, což právě by taky nemělo být. Takže já si myslím, že my jsme jako občani byli velice jako zapálení do toho a bojujeme, co to jde.
This allow me also to spend a second to thank our interpreters for making it possible, this cross-country debate. Thanks to all of you. This is very good that we collect some inputs on what citizens want, and I'm looking at Mr. Kökény, because you did an exercise of participation all around Hungary, speaking with medical practitioners, associations, and also with a specific survey, in another publication for the S&D Group and FEPS. You are actively contributing to political parties on understanding what is the plan. So it's literally from a fellow Eastern country. What do the practitioners, the experts want from Europe in the domain of health?
Yes, thank you very much indeed. This survey is not really very new. It was carried out just at the very beginning, or even of the COVID pandemic, or even partly before the pandemic. And the reason was that one of our socialist member of the European Parliament, István Ujhelyi, has really felt that it is absolutely unacceptable that the health indicators of Hungary's healthcare and the health of the people within the EU is becoming more and more tragic. And then the situation has not changed very much, but even at that, if I may just quote one indicator, the life expectancy at birth is 6 years below the European Union average. And I'm not going into the details, about the unhealthy lifestyle. I'm not going into the details that how much the current nationalist governance is neglecting people's health. I just mentioned that it doesn't even have a health ministry in Hungary. In Hungary, the Ministry of Interior is responsible for health, and they have only an undersecretary for health, and that it expresses, something that how the current elite or the current governing elite is thinking about health and healthcare, and public health the expenditures, the public expenditures for health do not reach the 4% of the GDP, which is just half of the European average at present. So in light of all this, a representative sample of 2,500 people was carried out through a telephone poll of the European Health Union, and the detailed results can be read in a FEPS publication. And it was not surprising, I will quote just some results, very, very few, that more than 70% of the population agreed with the strengthening of the European Health Union. Even more than a third of the strongly souverainist voters of the ruling party even. There was also a unanimous opinion regarding the fact that much more needs to be spent on healthcare. And as far as the medical and healthcare organization, we also had an online interview with a couple of them, and then there were several questions. And then, for instance, one of the questions was that what are the areas in healthcare where the current nation-state competence should be shared with the EU, and 46% of respondents mentioned epidemiology, of course not surprisingly in times of the pandemic. Then more than 20% of respondents mentioned public health. Rest of the responses covered a wide range of topics, and an issue of universal health coverage. Is there a need for instance, a European directive to guarantee universal, non-discriminatory access to publicly funded health services, etc., etc. More than half of the respondents said yes. And last but not at least, that it is interesting that the Hungarian specialists, doctors, found that the compulsory childhood vaccination to be better than in the EU in general in Hungary. So they wish to continue the domestic practice here, and then they were happy. It's a very few of the areas where probably Hungary still keeps a type of level, and in this case they didn't want more European intervention in this field. So it was quite an interesting survey, and I am very sorry that other countries have not followed that initiative, and maybe if we will have some further debates, there should really be more research about this, because together, but we have just heard from the citizens' voice, Svatopluki for me, it's so important, you know, to know that what people really would like to see. This is something you just cannot rely on, you know, your political experience.
Thank you. A similar question to you, President Nemeček. What is the role of the EU? Because you have been leading health policy at the national level, now you're doing so at the local level. Do you see angles where you would really appreciate the European Union stepping up, where they can help in just financing, setting standards, you know, regulating pharma? What would you be? You have a microphone in front of you.
First of all, I want to say I'm delighted to be able to participate in this meeting right here in the region where I lived, even though it's on the other side of the Orza River. So I see the area when we should manage healthcare politics in European level in two areas. We have all experienced the COVID epidemic, which has shaken for certainties in many ways and changed the world. We knew it before. We found that globalization ceases to function in such turbulent times. Initially, we liked masks. There were problems with vaccines and some medical supplies. And now a few years have passed, and we should ask ourselves if we are better prepared for similar situation. And for example, in Czech Republic, in my country, the government politicians boasted about building a strong national center for epidemiology and microbiology, and yet they did nothing. And I'm not aware of any progress at European level. And I am sure that infectious disease and the public health in general must be addressed at the European level. I think it's the first area that we should solve at European level. And another such area, I'm sure, is the production and distribution of drugs and medical devices. I think that we need to bring at least part of it back to Europe. And it's also clear that individual member states, especially the smaller ones, do not have the strength to negotiate on equal terms with multinational pharmaceutical giants regarding the condition for strategic drug supply. So at first, I should solve these two areas on European level. Of course, we can cooperate in many areas. We can exchange information, experiences, successful solution, but there is a problem with financing of healthcare and organization, and I think it will not be in very short time. But the first areas I think we should solve.
Two good suggestions indeed. Professor Kökény, let me come back to you. because you've been able to work with the European Socialist, Istvan, and many others, to also try to strategize on the different building blocks, policy areas that constitute the European Health Union we want. So perhaps can you, take us a little bit on what should be the components of this European Health Union? We mentioned something, but sure you can add more.
Well, I think in the previous session, I think our epidemiologist has mentioned Jon Snow's moment, Jon Snow is a famous epidemiologist, who discovered, that what could contribute to the cholera epidemic in the UK in the middle of the 19th century. And now I would like to say that probably just right before the European election, in terms of health policy and in terms of the competencies of the European Union in this field is coming close to a cosmopolitan moment, if I may use this type of expression. I think it's a special moment because we know a lot what has been done and what not has been done. We know a lot on, what could have been done better during the pandemic if we would have much more power for the European Union. We know a lot. We are listening, to coming some voices from nationalist forces who just think that health should really be a symbol of sovereignty of the member states. European Union has nothing to do with this, which is terrible to hear. So therefore, first of all, I suggest that we need to talk about openly, and we need more public debate. We should speak much more about health because that affects every citizen in the European Union. But my problem is that I can't hear so many voices about it, at least so far during the election campaign. So more talk is needed. National governments, insurances, patient organizations, public health people, etc., etc. What should be done? And I believe that there is a completely legitimate need, as we have heard at the beginning of our conference this morning from Vitenis. It's a completely legitimate need to supplement the treaties and classify health issues as shared competence in the EU. Yes, however, we should be aware that we should fight for this, but in the meantime, we have actions because, the time frame are different, of course. So there are a lot of other things to be done. And then let me just mention the inequality issue, for instance. The inequality, we all know that if you think Eastern European countries, if you compare it with Germany or France, and whether you think about, the nursing supply, the health workforce situation, if you just think about the health indicators, if you think about the various health determinants, or if you think about, the public spending on health, which I already mentioned, there are so many unacceptable differences which could lead to inequalities in access to care, which is also morally unacceptable in a unifying Europe. And that's why I think that, for instance, we often talk about the policy, health policy minimum standards and the requirements are concerned. And this initiative was raised by the public health strategy of the European Parliament at the outset of the pandemic in 2020, and not because of the unpreparedness of health systems in the societies, But because of witnessing that there's so many unjustified inequalities in health and in access to care. And these inequalities interfere with the implementation of the cross-border patient rights directive, but large differences in many other places. So, I think that after adequate testing, basic requirements for these must be developed and introduced. I, of course, know that these minimum standards are not grounded at the moment legally in the European Union. But still, if they do exist as recommendations, they may serve as a target model for the future. So I think that could also be an important thing. And then, of course, if I may add one more thing, I've already mentioned some part of it. We need a new period, a new next 5-year cycle in the European Union, where health policy is much more explicitly reflected in the structure of the EU decision-making. I think about the Independent Health Council configuration. I think about a separate health committee in the European Parliament, not merged with the environment. And last but not at least, independent portfolio, eventually even a vice president position in the European Commission, for instance, vice president for health and well-being together. If we should talk about this more honestly, you know, what should be done, how should be done, how we should achieve, of course, there are many, many more, but I stop here, then, of course, something might happen.
It sounds like a comprehensive agenda, and I like also the governance suggestion, because it's not only about you know, the policy that we want, but it's also how we organize the decision making. So, European Commission on Health and Well-being, I think it could be definitely a good way to go. But let me go back to Nicolas, because we discussed as well before about mental health. That's definitely a pressing issue for youth. The Commission has moved, thanks to the pressure of the general public and citizens, towards a European mental health strategy, as we discussed a bit. Do you see any hope there that the institution can respond to the needs of the people, or would you have other recommendations?
Já děkuji za slovo. Tady dneska už několikrát zaznělo, že duševní zdraví je tak trochu horké téma v dnešní době. Pro nás, jako pro mladé nebo pro moji generaci, já hodně vidím v okolí, že prostě skoro o ničem jiném moje generace nemluví. Jo. Tady je obrovský problém v tom, že spousta těch mladých trpí nějakým problémem a oni se bojí vyhledat tu pomoc, jo, protože já to znám jako od mých známých, co mají nějaké také problémy. Oni se bojí docházet k tomu doktoru, jo, protože teď si řeknou, půjdu k tadyhle psychologovi nebo k psychiatrovi a teď ze mě tady udělají prostě nějakýho blázna, řekněme, jo, říkám to tak, jak to moje generace říká, jo, omlouvám se, tak to samozřejmě není, jo. Za covidu prostě, jak jsme byli doma, nebyl kontakt, tak tady ty duševní problémy se prostě hrozně rozvinuly. Takže já věřím a doufám, že Evropská unie, Evropská komise prostě přijde s nějakým celoevropským řešením, ale je to velice složité téma, ale trápí prostě celou Evropu, jak jsem dneska mohl slyšet i včera. Další problém, co se týče toho mentálního zdraví, tak je to, že místo toho, aby ti mladí vyhledali nějakou odbornou pomoc, tak šahají radši po nějakých závislostech, což je taky velice rozšířený téma. Třeba teď v České republice je kampaň s seriálem Addict, to mi se jmenuje, nevím, jestli jste neslyšel. Je to seriál, kde vlastně se ukazuje, jak je špatná závislost na nějakých látkách, jak by aby to ty mladí od toho odradilo a oni stejně po tady z těch látkách koukají a to je velice špatně, takže by měla fungovat něco, co prostě ty mladí přiměje k tomu, aby se zajímali víc o své zdraví a nešahali o tady ty prostě špatné věci, nelegální věci, o ty závislosti, protože to není prostě pro to zdraví dobře. Děkuju.
I give a second for the interpretation to end. Thanks. But good, that is the important stuff. President Nemeček, I come back to you with a difficult question. Actually, probably my last. If you have more, we can try to take them. Because we've heard how much health is affecting citizens, how much they need a different and more affordable and more present support on mental health. It's literally a pressing issue. At FEPS we also run statistics and opinion polls on the youth, and even the young people, they put health as a top political priority. How can we not win elections on health? This is the somehow. So how to popularize or politicize the debate a little bit more? At the European Union level, for instance, it was the center right that was telling to member states, cut on health to save your public finances, and then of course COVID came, you know, as part of the austerity, for instance. Why the progressives in general, center-left, social democratic coalitions that are historically for strong public sector and health, we are not gathering more support? How we can galvanize
in Europe or
here in any where you want, like popularizing health and winning with health, getting support?
I don't know because I think we in Czech Republic, we are in the opposite situation, because I think in the last 10 years we have really very high level of the quality of the healthcare system, and this very low payment of people. And now we are in the point where our system is starting to going down. Now to the healthcare is in healthcare we have more money than in the last years, but the quality is stopping, and I think then the system will go down. We have a problem with demography, with demography in the patient sphere, but with demographic problem in healthcare professionals. For instance, in Czech Republic now, the 1/2 of the general practitioners are older than 60 years, one half, and about 15% are older than 70 years. So I think that we will have a great problem with keep the quality of healthcare in our country, and it's very strange that there is no debate about healthcare in Czech Republic. Nothing. The minister from the right wing coalition now is making minister, but he's nothing. He's doing nothing really. No, every problems are going further, and for people it's not a theme. Maybe the only theme where the availability of the dentist care in Czech Republic, but I think that the same problem will be in 5 years the problem with general practitioners. So I don't know how to manage it.
If I may add, although you have not asked me, as I see. Again, to put health higher on the debates with the public, I think we should focus on issues that affect people in the day-to-day practice. So doctors are very important, nurses are very important. But when there is a debate, we should not professionalize it very much in public. We should, you know, start what are the problems of the patients, that why they should wait for a cardiac ultrasound for 6 months, you know. These are concrete examples from Hungary. Why it is that if you have an orthopedic problem and then you are offered surgery with your knee for 3 years waiting time, 3 years at the moment. But if you go to the private hospital, then of course you pay a terribly lot of money, in addition that you pay for your insurances as well. Then you will be operated within, let me see, 6 weeks or whatever. So why it is so? So I think these issues should be openly discussed together with the patients, together with the media. We should put good podcasts, use the social media. I think this is not really well utilized. And I think probably the progressive forces, the European socialists, should take it even more seriously, I would say, because that's, I mean, I see that I mentioned the inequalities, the huge differences in access to care or whatever you talk about. I mean, these are not really well addressed, even in the PSC documents as well. So I think that's probably an entry point.
Thanks a lot. I will go back to Brussels with this idea of putting into European Health Union as a minimum standard of maximum 30 days waiting period for a medical exam. That's what Progressive wants, to be precise. Now, please help me to clap your hands to thank our speakers, in particular Nicolas Moravec, who has to leave us. Actually, have to catch a train. So I'll free you. We do a little bit of a switch. We say goodbye to Nicolas, and I invite here